Hi, it's Liz Calloway, and I'm back at 360 Healthcare with Dr. Janine Rummel. We are here talking about dry needling. What in the world is dry needling? Is it like acupuncture or is it different?
So we use the same needles as acupuncture needles, except for it's a completely different placement. So a very different technique from acupuncture, where acupuncture is typically following traditional Chinese medicine. What we're doing with the needles is placing them in trigger points, which a trigger point is an accumulation of lactic acid, inflammation, all the junk that settles in our body when we abuse it.
Okay, or repetitive use injuries type of things. Right?
We're still abusing a little bit, right?
So is this something that a lot of athletes would use, or someone who's very active, or really anybody could benefit from?
Really anybody. So when we look at a trigger point, we can have two different types, an active and a latent trigger point. And active trigger points are the ones that you go, wow, that hurts, it burns. A latent trigger point is one that's there that you don't feel until someone like me or someone else that does dry needling or a massage therapist, till they start to work into those muscles and you go, I didn't even know that was sore. I didn't know that hurt.
But a lot of your pain kind of radiates from that particular trigger point. So now you're mentioning needles. Of course, a lot of people are going to freak out.
Sure.
So what does a needle look like?
So I've got some needles right here.
Okay.
And they are super tiny. So I'm going to show you what it would look like for dry needling. All we do is just tap a needle into the skin. Just like that. Super small. Does not hurt.
Okay, and by that going into your trigger point, there's no blood involved.
No.
No blood involved. And that going into your trigger point could give someone instant relief?
Absolutely. So what happens is, if we get, it's called a muscle twitch response, the muscle will actually grab onto the needle and then back right off, which that's going to make that trigger point go away for us.
So how long do you have to have that needle in you?
Right, so we like, and from my training, is to keep the needles in a little bit longer, so closer to about 15 to 20 minutes.
Okay.
And what that's going to do is work on receptors inside muscles, tendons, and ligaments.
So let's say this was, I have a pain in my neck, and I keep going back there because I have the pain in my neck. It has a name on it too, by the way. But let's say if I had a pain on my neck, and let's say this was the area, would there be a trigger point here?
Possibly. So first, obviously, an evaluation and an exam.
Find the trigger point.
Yep.
And then how many needles would you put in there?
It honestly depends on location and then severity of how bad your condition is. We could be using one needle, could be 10 needles, could be 15 needles, really just depends. Okay. But honestly, once one needle goes in, most people don't feel the rest of them.
Really? Okay. So there's no pain, no blood involved. You come for an initial consultation for this, or do you get treated all in the same?
Typically, treatment is the same day as a consultation, but it really just depends upon when someone's ready to start treatment. There's other factors.
Now, how many times should one expect to come back and treat the same area? I mean, does it work sometimes in just one session?
Absolutely.
Oh, okay.
Yeah, some people we see one treatment and that does the trick. Again, just like anything else that we do in life, if it's more of a repetitive issue, that usually means you become a repetitive patient. Because if we don't change our habits outside of what you're doing here to try to make them better.
But is there ever a limit of to how many dry needling sessions you can have? Is there anything that's negative?
Right, since everything that we do in this office is holistic, and we're looking at the body as a whole and only things that are going to overall improve our health, there's really no limit to anything that we do. It's not like conventional medicine where you go, 3 of this and that's it, you're done. What's nice is, but since we do have so many options, there is also other therapies that we could do to help with the dry needling as well. Okay,
well that's all about dry needling right here with Dr. Janine Rummel. If you want to make your appointment, give 360 Healthcare a call. What's the number here?
It's 843-692-9243.
And they're located at 4810 North Kings Highway in Myrtle Beach.